Hello, and welcome to our fourth summer school. My name is Hilda Hayo, Chief Admiral Nurse and CEO of Dementia UK. I'm going to tell you about the origins of the charity, about Admiral Nursing, and also about our strategy for 2020 and beyond. In the 1980s, a gentleman called Joseph Levy was diagnosed with vascular dementia. His family felt that although he had good support, they didn't get as much support as they needed as a family. They decided to do something about that. First, they got some carers training together with a local psychiatrist. Then after a while, they thought actually there needed to be something more. There needed to be a nurse that could work with the family who are impacted by dementia. They weren't quite sure what to call these nurses, but the grandchildren suggested that they be called Admiral nurses. Because Joseph Levy, who had the diagnosis of vascular dementia, loved sailing. And his love of sailing meant his nickname was Admiral Joe. So that's why we're called Admiral nurses. So 1990, they had a few Admiral nurses in London, and gradually over the years that number began to increase. So in 94-95, the family decided actually now's the time to found a charity. So along came our charity. Been called a few different names over the time, but in 2010 the family decided to rename us Dementia UK. So what do Admiral nurses do? Well, we're specialist dementia nurses, and we specialise in supporting families and people living with the impact of dementia. We work across a range of different services and pathways in a range of settings, anything from acute hospitals to other charities, primary care, you name it. Wherever there is somebody with dementia, that's where we try and get our Admiral nurses. And for those places that haven't got an Admiral nurse on the ground in their local area, we also have the national services that we run as a charity, which is the helpline and the clinics and our consultant Admiral nurses. At the moment, we have over 453 Admiral nurses in the UK, and that number grows on a consistent basis. So where do our Admiral nurses mainly get sighted? Acute hospitals and primary care is the areas that we would like to kind of get our Admiral nurses into, because that touches the lives of many people that are facing the complexities of dementia. In the community, in hospices, in other charities, anywhere, as I've said before, that there are people and families that need our support. Most of our services are hosted by the different arrangements that we have in local areas. But there are around 50 nurses that are part funded by Dementia UK and the hosts. And we actually have that part funding so that we can grow the numbers of Admiral nurses strategically throughout the UK. As I mentioned before, we've got nurses that are employed directly by Dementia UK, and they work on the helpline and in the clinics, and also as consultant Admiral nurses. Over the year, we usually have about 38,000 people just supported by the nurses that we employ in Dementia UK, and that number is steadily rising year on year. Our national consultant Admiral nurse posts are in areas that we feel are underserved, are unsupported by the current services and support for dementia. So that includes frailty, Lewy body dementia, young onset dementia, LGBTQ+, and children and young people. And more of those consultant Admiral nurse posts will be developed over time. So I said I was going to tell you a little bit about our strategy for 2020 to 25. We're in the last year of the strategy now, and we're doing exceptionally well in being able to achieve what we planned to achieve way back in 2020. So by the 31st of March 2025, we aim to have 500 Admiral nurses, and we're well on track for that. We wanted to develop all of the services and support locally for underserved communities, and we're well on track for that, particularly when we're looking at young onset dementia, we're looking at different cultural groups, particularly when we're working with people that are from backgrounds whereby they wouldn't necessarily engage with the traditional services for primary care or for hospitals, etc. We also write about the effectiveness of Admiral nurses in articles, publications, in books, in evaluations, and we present at conferences, all so that we can grow the awareness of the necessary specialist dementia support that families living with dementia need. We also have the Admiral Nurse Academy, and the Admiral Nurse Academy has grown over time. At the moment, it supports our Admiral nurses, and we do the summer school on an annual basis. But what we would like to do is we would like to have modules and resources that can be utilised by anybody that's interested in improving clinical practice for people living with dementia. We're investing strategically to develop Admiral nurse posts and services to meet the local needs of these different areas. We're not happy that we haven't got full coverage as yet. There are still some counties that have very sparse resource. We've got a couple of Admiral nurses across the border in Scotland. We need many more. And we still have to get our first Admiral nurse in Northern Ireland. But we are working hard on doing that. We've got a relatively new policy, public affairs and campaigns team. And we've been very active in trying to get policy recognised that needs to be improved by government and by different policies and different resources nationally for people living with the impact of dementia. So one of the pieces of work that we've been doing as a campaign is called Fix the Funding, which is talking about continued healthcare funding and the difficulties that families living with dementia have in accessing that. It desperately needs to be reviewed. We're also concentrating on making sure that people that are living with young onset dementia are receiving the support that they need. And we need to have a pathway to be able to get the support that's needed both pre-diagnosis and then after diagnosis. We've submitted our first ever manifesto to the parties, and what we're asking for is an Admiral nurse to support acute hospitals across the board. We do have quite a few acute Admiral nurses, but we could have a lot more. We're talking about increasing the numbers of Admiral nurses in primary care, because the vast majority of people living with dementia are living in the community, and they're living with the support of a GP and primary care services. We need to make sure that they're also able to contact and be supported by a specialist dementia nurse. We're asking for a young onset dementia pathway. We know it takes, on average, about 4.5 years to get an accurate diagnosis of young onset dementia. That simply is not good enough. And we need to do more on pre-diagnosis, raising awareness, and also making sure that specialist advice and support is available throughout that journey with young onset dementia. As I said before, continuing healthcare funding wasn't really designed for people living with dementia. It was designed for people with cancer and other long-term conditions. And therefore, when families living with dementia are trying to access an assessment and funding from continuing healthcare funding, that simply doesn't exist, or very patchwork in some parts of the country. So we're campaigning to actually have more of an awareness of how people with dementia should be able to access that very valuable funding. So that leads me on to where we're going to go from 2025 to 2030. We've just started work on the strategy and we aim to release that on the 1st of April 2025. We also have a few ideas of where we need to be by 2030. We need to have 1,000 Admiral nurses across the UK that should be able to be contacted by families living with dementia and get the specialist support that they need. We're aiming to support 250,000 people with dementia through our services that we employ Admiral nurses, that we actually provide as a charity. And that's in addition to the numbers of families that are actually supported by Admiral nurses that are working in local areas. I'm determined I'm going to have Admiral nurses in all parts of the UK, Northern Ireland included, of course. The Admiral Nurse Academy will continue to grow, and we're aiming to have that open to non-Admiral nurses so that we can encourage people to give the best quality care possible to those families living and impacted by dementia. We have our first ever research strategy, and our research is going to be into the specialist dementia care and support that families should receive when they're living with dementia. We also want to have a growth in influencing the policy for underserved communities and for the more complex end of dementia, and we will continue with that work. One of the most common questions I get asked is, there's quite a few of you as dementia charities, can't you just all join together, or don't you all do the same thing? Back in 2020, myself and my opposite number at Alzheimer's Society decided to get together and get some of the other dementia charities all in one room so we could work on identifying our USPs and areas of collaborative working. We wanted to know how can we be recognised by that, so we now call ourselves One Dementia Voice. So we collaborate on different campaigns, on manifestos, on all of the things that might make a difference to families impacted by dementia. Our USP is specialist dementia nursing, Admiral nurses. None of the other organisations that we work with have that clinical component. So who are the parts of One Dementia Voice? There's Alzheimer's Research UK, Alzheimer's Society, Dementia Carers Count, us, Dementia UK, Innovations in Dementia, who also host DEEP, John's Campaign, Lewy Body Society, Rare Dementia Support, Tide, and the Young Dementia Network. So most of the people that are the movers and shakers in the world of dementia. So thank you so much to everyone for listening. Please do look at our website where you can get information and resources, where you can get updates about how we are improving the specialist care and support for people living with dementia and their families, where you can also get details about employment opportunities within the charity. We're a growing charity. We're always on the lookout for really excellent nurses that can really make a difference for people living with dementia. But it's not just nurses. We have other jobs as well within our charity, whether that's working in the business side, whether it's fundraising, whether it's marketing, whether it's comms. There are many different posts that we will be advertising over the next year and certainly within the next 2 or 3 years. So thank you all so much for listening. I really appreciate it, and I hope the summer school is going to really make you enthused about working in the field of dementia. So thank you very much. Goodbye.